Hi everyone, my name is Micah Guidry. I am the manager here at LaBelle Cosmetic Surgery Center.
Hi, I'm Dr. Jay Purao. I'm a cosmetic surgeon in this place, and I'm diplomate of American Board of Cosmetic Surgery. I'm also a board certified general surgeon.
We're going to talk about brow lift and eyelids, upper and lower. We hear a lot of patients that say they have real bags under their eyes, dark circles, or on top of their eye there's excess skin, deep wrinkles. So there's a lot of issues there, but what we want to clarify today is the differences in the procedure, but however, you may need more than what you actually think. So we're going to start right off the bat. Doc, what do you tell patients that have eyelid trouble?
Absolutely. I mean, that's one of the most common operations we do here, fixing the eyelids. There are three components for sagging upper or lower eyelids. People see their eyelids sagging and the lower eyelids bulging with fat underneath and also sagging. It's a combination of three different things. Gravity is one, of course. Gravity drops everything down. Now, let's talk about upper eyelid first, for example. Upper eyelid is controlled by three factors. Excess skin, that's one. That's pulled down by gravity. Number two, the eyebrow dropping also drops the upper eyelid. And number three, the excess fat under the upper eyelid comes from inside the cavity of the eye. That's called the socket of the eye. That comes out because of gravity and age. So these three factors control the upper eyelid. Similarly, the lower eyelid too, same way. Excess skin that's pulled down by gravity, and the fat from inside the eye socket comes out. That makes it bulgy and puffy. And the third important thing is the cheeks have dropped down because of gravity. That opens up the space, allows the eyelids to drop further. So there are three factors involved in each eyelid. Of course, most patients do not need all three corrected, but they have to be looked at as a unit together to understand the problems of eyelid.
Yeah, we tell patients a lot when we're looking at the upper eyelid. The eyebrows is a good indication of brow lifts, if you need one or not. Women's eyebrows should be right above the bone right here, whereas men's fall right on the line. So as a woman, if you find that your eyebrows are right on that bone, that's a good indication that we could lift a little just to give you a more natural or more woman-like appearance, because we're not going to pull all of this up, right, and give a scary windblown look. How do you determine how to pull up what and how deep to dissect?
Right. Let's back up a little bit. We're talking about eyebrow lift right now because that's one of the components of upper eyelid. A lot of people just require a brow lift to make the whole upper eyelid look right. They may not have excess skin, they may not have fat under the skin. They just need a brow lift. They think they need an eyelid lift. So here's the deal. There are many ways to do brow lifts. The standard old-fashioned ways to do cut from here to here, coronal brow lift. The incision about an inch behind the hairline, and pull it out and cut the excess and throw it away. What it does is to lift up the whole eyebrow, the whole arch, high up, and remove that much of the hair-bearing skin. So the actual hairline recedes backwards. That's not necessarily very pretty in some people. But that's the old-fashioned standard technique. There are several modifications to the same technique. But the more newer ones involve endoscopic brow lift, which avoids a big scar, makes small scars, several small scars, and lifts the eyebrow from under the skin without removing any excess skin. That's endoscopic. They are very commonly performed. They do achieve the results, but it does not remove the excess skin. So a lot of times it may leave behind crease in the forehead, or it will drop back later on, rather sooner than later. So that's one of the drawbacks of endoscopic brow lift. Another way to do, one of the more recent techniques that we use here all the time is something in between, which we call a transfollicular brow lift, which is a form of coronal, but it's not coronal because it is the incision goes right on the hairline. Then we go right under the skin, lift the brow, and cut excess skin. So it cuts sharp, it takes excess skin out. It leaves behind a clean forehead, but then we also lift only the middle part of the eyebrow, not the whole eyebrow. So you want a completely surprised look. but just a better arch of the eyebrow. And that'll lift the upper eyelid too. So a lot of people just need a brow lift to correct the upper eyelid. But then once the brow component is off, taken care of, then you know how much eyelid to skin to remove, and if there's fat underneath, that can also be removed. These operations can be combined or done separately. But if somebody requires a brow lift and they don't have it, they don't take it, but only do the upper eyelid, then you do the eyelid surgery. No matter how good the surgery is, the eyes will look very sunken later on. This happens to a lot of people, a lot of surgeons, a lot of patients undergo this type of surgery by someone and then wonder about why the eyes don't look better. That's very important to understand that. But other than that, to take care of the eyelid itself means three things. Remove the excess skin, take care of the components such as the eyebrow or the cheek descent, and number three, take the excess fat out. But don't take too much fat out, just enough to make sure it's flat. And it can be done many ways. So upper eyelid usually requires a crease, a cut that looks like a natural crease that normal people have for the upper eyelid. Lower eyelid can be done in two different ways. We can make a cut on the outside, right under the lashes, or we can make a cut on the inside of the eye in the conjunctiva, and you won't even have a scar. So these are variables, and we need to discuss based upon individual needs. And this is another procedure which we commonly do, and easy recovery, and patients are very happy after this because a lot of times the eyelids give away your age.
Yes, and a lot of patients tell us by the end of the day they feel their eyes are heavy, and sometimes in some cases this is a necessity that patients do need to see an actual eye doctor that can determine if it becomes a vision issue. But some patients, it is just excess skin and just a heaviness at the end of the day that becomes puffy, and those are things that we can correct. But I do want to add different candidates. When we talk about eyes, Asian eyes are more difficult to target, is that correct?
Absolutely. Asian eyes are made differently, they're congenitally different, they're delicate, more delicate operation, and anatomically very different from Caucasian eyes. And surgery for that is very delicate, and it's different, and that can also be done very well.
Also, when we're talking about the different eye troubles, we hear a lot of patients that have complaints about dark circles under eyes. Some cases there is a shadowing effect because of the fat underneath there. A lot of times it is hereditary. There is no natural cure for it, but we do see patients that have this type of procedure done. It does improve the discoloration, but just know that it's not going to completely take it away, and there's no real cure for that yet.
Yes, there are lots of products available that may help, but not necessarily guarantee help. But believe it or not, half the time the dark circle around has to do with shadowing, because lights come from the top and the lower eyelid is puffy and it creates a little shadow under the eyelid that looks dark. And that's at least a component of the dark skin. Some people have, that's the only problem. Others may have a part shadowing, part dark skin.
Yeah. So patients that are interested in different eye procedures or a brow lift, as you can tell from what Dr. J said, there's very different components that make up the eyes and make up the brow. There's a lot of different options. We want you to be well informed of the different options, and you should make a very important decision when you're looking at different surgeons and who can do what for you, and look at all the options that you have, because like he said, if you do one procedure and you don't do the other, sometimes you can end up with an effect that we can't reverse. So do your research.
Yeah. What she's just trying to explain is every component needs to be looked at. For example, in upper eyelid surgery, basic surgery includes taking excess skin out. But if the patient also has a brow that is dropped, if you take all the skin that's excess out, the eyes will look sunken. But if you lift the brow and then take some excess skin out, the skin becomes only half as much or even less skin that needs to be taken out. So if you don't pay attention to this detail and do, for example, eyelid first and then it doesn't look right, you want a brow lifter later on, you will get complications with the eyelid. So these are the nuances people need to know before they get into this kind of stuff. Similarly, lower eyelids have their own issues. So we need to discuss all that before getting into the surgery. One other thing is the eyes themselves need to be right. People with dry eye syndrome will have a lot of complications after these surgeries. So it's always a very good idea to talk to a regular ophthalmologist to make sure it's not the eyelid skin that's dropping, not eyelid itself is dropping. That's a whole different ballgame. That's not a cosmetic surgery, that's an eyelid medical surgery. Same way dry eyes will cause trouble too. So these are issues that need to be taken care of before we consider surgery.
And as we said, when you're looking into these procedures, make sure you choose a doctor that is very comfortable in this and get all the information that you can first before making a decision, and make sure you make an informative one. So we look forward to seeing you whenever you're ready.
Thank you.
Thanks.